All right, well, welcome everyone. This is the first of our series, our second Tuesday speaker series within the Child Development Department. We really brought this together. We wanted to show really the intersectionality between child development and other majors and other fields, and also just kind of give an idea of some of the things that you can do with a background in child development, with a degree in child development. And today we have the lovely Raisha Jackson, and she is joining us from Rady Children's Hospital. And I will let her also introduce herself and talk a little bit, formally introduce her position and what she does at Rady, and then we will get started with our panel.
Hi, everyone. Like Lena said, my name is Raisha. I am a developmental specialist at Rady Children's Hospital. What does that mean? Because that's like, wait, what does a developmental specialist do in a hospital? So we are actually contracted with Child Welfare Services to provide developmental and behavior screenings to all little ones 6 and under who have an open case. And so we do a lot of case management. We work with communities, community resources. We work hand in hand with social workers. We work with foster parents and just supporting that relationship with the foster child and the parents, or that reunification.
That's awesome and important work. Thank you for joining us today. And if you could just share a little bit about how you got started in this position. You can share either just a little bit of your background, and then also just how you were able to just got to this position.
Okay, thank you. So my background is very interesting. So, well, at least I think it is. I actually started out at what's called a child life specialist. And so this is where you are in, it's another aspect of the hospital support system. So it's where you actually come in and you help support children who are in the hospital setting, so who are going through different procedures. For instance, my background, I was in a rehabilitation hospital, so I worked with a lot of children who had traumatic brain injuries, spinal cord injuries, had some feeding concerns, and what my role in was at that point was helping support them, so doing a lot of education of how it's abnormal to be in the hospital, but making it as normalized as possible. From there, I then transitioned, because I was originally in Texas, and then transitioned to San Diego and found the developmental specialist job and applied for it. And I think it's amazing because it's something totally different, where I'm working in both the hospital setting, but also in the community setting at the same time. A little background of like the degrees the path that I went to get there is I did an undergrad degree in rehabilitation and psychology, and then transitioned to get my master's in child and family development with a concentration in child life.
Thank you. And I didn't actually ask this question ahead of time, or didn't provide this question ahead of time, but out of curiosity, because you've worked at 2 children's hospitals, and that's kind of, or at least 2, there might be more, but can you describe just kind of how big those departments are, and like what kind of types of positions are we talking about within that, in addition to the ones you called?
Oh, yes. So as a child life specialist, that hospital was a little smaller. So it was a 45-bed hospital. And so that's similar to like if you go to like a nursing home and it's really small and intimate. However, it was a smaller department, but within a huge hospital system. And so, for instance, if you are familiar with any children's hospital, it's Children's Hospital of Dallas. And so that system is throughout the Dallas County. But the hospital was a little small entity of it. And then with Rady's right now, we are, again, a program within a hospital system. And so our program, we have 45 people in our program. And so I think that's a huge team, but I know like some of our developmental specialists that work in healthy development services, their team is almost 60 or 70. So the departments, yeah, it's big. The departments are large, but you get to know everyone in different aspects. So for instance, I am in the program of developmental screening, which we're contracted, but like I said, the Healthy Development Services, they have developmental specialists also, but they don't go in home, they're strictly in the hospital setting.
Thank you. And if you could just share a little bit, if there was an internship, a course, or an experience along the way that was really just instrumental in the role that you have today. So if, just like if there's any sort of course that you reflect back upon, or any internship experience that really helped you get to where you are today.
My internship and practicum, I would say, was instrumental. I did a practicum at a place called Wonders and Worries in Austin, Texas, and that unique establishment was focused on working with families, working with children who have lost a parent, and learning grief and doing grief groups and understanding the difference between grief and bereavement and how to process that at such a young age. And then additionally, with my internship at East Tennessee Children's Hospital, I've learned how to not just advocate for others, but understanding how to have a really nice balance of advocating for yourself, but also advocating for children, because when we think about it, children can only express so much. And when they're in pain, sometimes they don't have the words to articulate what's going on. So especially if they don't have a parent that's present, they need someone there that's on their side and advocating for their pain management, or advocating for having a little bit more education of what is going on in the steps in a procedure. And then I think those two actually prepared me for the role I have now, because especially now I'm working with a totally different at-risk population when we're looking at child welfare system. And so learning just now, not advocating for children, but also advocating for their parents and adults who just don't know the questions to ask when they are in the middle of a meeting with social workers, attorneys, and service providers. Well, I have a question, but I really don't know how to ask this, and I don't want to seem like I don't know. So just being their support and their advocate also.
Yeah, that's a really good way to describe that, and really, like I said, an important role in that. Can you describe a little bit just what an average day looks like for you? And we also know this past year has changed things. I think we're officially on like the year mark. I don't know exactly what the day is, but yeah, feel free to expand. Maybe you can even break it down, like what a typical day looked like pre-COVID or pre-lockdown remote work, and either how things have changed, or if it's just completely different now, what that looks like.
Okay, thank you. Great question. Pre-COVID, we were an in-home service. So we would actually go out and go into the homes of all of our clients and do the developmental behavior screenings. We will meet them in the community where they were, whether that's in a CWS child welfare office, or in their actual home, or in a rehabilitation center. We were very flexible. So we cover the whole entire San Diego County, all the way up to Camp Pendleton, all the way down to San Ysidro. And so, as you can imagine, that's a lot of driving. So our car became our office, quote unquote. So it was a lot of driving, but it was a lot of being in their home, because I noticed that when you're in their home or in their space, you are able to pick up a lot of different things that you may not be able to pick up on screen or via virtual. Since COVID hit, we are now doing everything virtually, which is a huge adjustment, because it's learning how to be a lot more creative in how we're doing our screenings. For instance, when I would do the developmental screening, it would be me and the child, and we'll do like this whole entire interactive thing, like we'll have fun, we'll be jumping. Trying to do that on screen it's totally different, because having children 6 and under sit for an hour and a half is really hard, because they're like, I want to go do something else. I need to move my body. And so how we incorporate moving the body and trying to be a little bit more flexible in how we actually do our assessments are now, like, for instance, when I do my screening, I start with part of my development. So we're getting our bodies moving, they're actually engaged, and then we'll switch to caregiver and I talking, and then that way I can still observe the child and see what the child is doing naturally. And then at the end, anything that I did not see, we will then continue the developmental one.
That's interesting. Yeah, it's great that you were about, and it's just out of curiosity, about how long did it take you to adapt to those nuances? Just personally, I imagine there was kind of that initial like, or I think even March last year, we thought maybe we'll be in this environment for 3 weeks and we'll all go back and the good old days. So was there kind of, what did that learning curve look like for you?
That learning curve was very interesting because we thought the same thing. We thought like, oh, this will be a month or two, then we'll transition back. I have to say our leaders were really, really open to our feedback and understanding, like, since we are doing the developmental specialists and behavior specialists, since we are the ones that are doing the virtual calls and doing the virtual telehealth, that we're seeing things and things are changing so rapidly that they were in the back creating our protocols as we were like, oh, well, maybe this is better. They were creating protocols, and then we were trial and error for almost 6.5, 7 months. And then once we felt like, oh, we really got it down, something else happened. So for instance, we were able to, when COVID initially hit, as a hospital system, they allowed us to do FaceTime, Zoom, and Microsoft Teams. Then 6 months in, after everything kind of calmed down, they did not allow us to do FaceTime anymore because it's not encrypted. So Zoom and Microsoft Teams, we can encrypt our appointments, because especially since we're talking about a lot of patient health information, we need everything encrypted. And so that kind of threw us for a curve because a lot of our families may not have Zoom or Microsoft Teams, but a lot of them have iPhones where they can just, hey, we can do the meeting face to face. So that was a huge learning curve. And then the other learning curve would be just being a little bit more creative and doing a lot more research of, okay, well, how are the teachers in the field doing this? Because now they're teaching virtually too. So I have the pleasure of having 2 best friends that are teachers. And so they were able to show me that they do the Google Slides teaching classrooms. And so we have adapted that into our enrichment sessions. And then also our speech therapist and occupational therapist was able to do a whole entire training of like how to engage kids, because half of which we found out, our speech therapy department was already doing telehealth this way, but then it switched. So they were kind of like above the ball. So.
Yeah, it sounds like you really utilized teamwork and really had to utilize your colleagues and even your friends in this.
Yes.
What would you say is the biggest obstacle you've faced in your career journey, and maybe even a challenge within the work that you do as well?
Ooh, the largest obstacle is advocating. And I know I said that earlier, but advocating for yourself, but also advocating for others, I've learned is a huge obstacle. One, because depending on the space, you have to be able to understand and articulate the needs of your client in a way that the service providers or the social workers or even the judges will understand the need. In addition, like as I was a child aid specialist, being able to understand the medical terminology to then be able to communicate that to the caregivers, but also having the doctors understand, looking at like social emotional and mental health aspect of this is important because of this, versus they're like, no, this is what medicine says, this is what science says, this is what we're going with. And it's like, wait a minute. So actually taking a step back and realizing like to not just advocate, but understanding communication styles and understanding how to effectively communicate in all areas.
And just to expand on that a little bit, I can picture when you're pursuing a family and child health or development degree, that you're not, you know, picturing, oh, I'm going to be an advocate the way a lawyer is, or that I'm going to have, you know, how did you personally just develop those skills as you realized that this was going to be an important aspect of your job?
I had the pleasure of having an amazing mentor in one of my internships, because when you go through the classes, you're like, I'm only going to work with kids. And then you realize, like, oh no, kids are attached to parents. So then you're like, oh no, was I trained to actually communicate with adults? So luckily I had an amazing mentor that I was able to not just shadow, but actually ask those tough questions of, okay, this parent is really hard to engage. What are some tools? What are some strategies? Luckily she was like, oh, well, let me go visit them and show me in time. So like actually mimic and model for me. And so that was amazing for me. And then honestly, on the job experience, that's the one thing I can say if for anything is experience. Especially like when going to speaking to doctors. If you've never spoke to a doctor before, it can be intimidating, especially if it's a doctor that is more science-based than customer-based. It's a huge intimidating experience. So understanding that, hey, I am an expertise in my area. This is my area and my field, and then we can work together to provide the best customer service for this patient or client. So yeah.
That's awesome. Thank you for sharing.
Mm-hmm.
And especially at, I know Rady's, and I'm sure all the children's hospitals, you know, they're there because they're great at what they do on the science end, but I understand that could also be probably, or at least I would feel intimidated to go in and try to, you know, share or give my thoughts to this person who's published how whatever and comes from some big background, and to just assert yourself as that expert in your area.
Yes, ma'am.
So you talked a little bit about the challenges, and I mean, even as you describe your job, I don't think it's, you know, I think a lot of us could picture what a lot of the challenges that would come with that would be. What are some of the things that were maybe that, or just things that you enjoy, but also things that maybe were a little surprising, but pleasantly surprising about it you weren't expecting?
Okay. Some things that I enjoy are, one, really seeing, for me, a biological parent right now doing the work to get their children back. Because it is not an easy task when child welfare services come into anyone's life. And this is one thing I've also learned, because I've never had a case open or actually work with them prior to this job. So learning that when child welfare comes into a family's life, it is bittersweet, to say the least. Like, it is bitter because you have social workers calling you at all times of the day. If a parent works a full-time job, they're expected to answer the phone at any time. They're expected to, if the social worker says, hey, I need to come and we have a meeting, like, it's a lot of expectations, a lot of managing schedules, a lot of being able to be in multiple places at once, and you're only one person. The sweet part is the services and the amount of opportunities that are offered to these families are impeccable. Some services, I know with Rady's, we have what's called Developmental Evaluation Clinic. And this is a service where they can actually get a comprehensive evaluation to see from a developmental psychologist, just to assess and evaluate the child's need, like developmental needs, and see if there's any additional services that are needed. Without being in CWS care, that appointment is almost I want to say we have like almost 1,000 people on this wait list. So with being in child welfare, you kind of get bumped up. But also one thing that I've learned, which I think is amazing, is that the resiliency of not just the children, but also the families too.
That's really important to, I think, for anyone to remember who works with kids, and to a good takeaway that we could all utilize in our fields. So I'm going to actually stop the formal questions recording piece of this. So before we sign off with that piece, I just want to say thank you again for joining us and sharing a little bit about your journey.
My pleasure. Thank you for inviting me. Thank you.